Rose Roach is the volunteer director of unions for single payers. She spent 34 years in the labor movement in Minnesota, between Minnesota and California, and most recently had been the executive director of the Minnesota Nurses Association. And now in her retirement, she's taken on the positions of both the national coordinator of the labor campaign for single payer and the chair of Healthcare for All Minnesota. And we're so excited to have her here with us today with her broad wealth of knowledge about unions in general and specifically the nurses movement strategy and all those sorts of things. So thank you so much for being with us today.
Oh my gosh, thanks for having me. Hello, Opes. It's good to be back with you all here. I'm going to go ahead and just hope that technology is working for me and share a screen, and I'll go through a bit of a PowerPoint, and then we will get together and talk. Are you seeing the PowerPoint okay?
Yes. Yes.
All right. Excellent. Well, again, good evening to everyone. I really am honored to be here to present to you this evening. Greetings of health and solidarity. I entitled my presentation Pathways to Healthcare Justice because the work that I've been engaged in recently, particularly with whether it's been on a national level with the labor campaign for single payer or on a state level as the chair of Healthcare for All Minnesota, it's become clear that we really need to be thinking strategically about building the foundation that we're going to need to actually win single payer. Therefore, I'm going to start by highlighting just a few of the realities we're dealing with in this current healthcare environment. Then I'll talk a bit about the labor campaign for single payer and how we're viewing that environment from a worker perspective. And then finally share with you some really solid work that we've done here in Minnesota this past session to begin our transition to the Minnesota Health Plan, which is the name of our state single payer bill. So I think that, this just tells a story. I'm not going to read the headlines, but these are headlines from recent newspapers, and you can see where our healthcare system is going, right? And I would ask the question, these kinds of headlines, do they really indicate a healthcare system, or are they more of a healthcare marketplace? Just the latest one the other day here in Minnesota, a Minnesota woman with unpaid bills will lose doctors after she gives birth because she's in arrears, and they won't therefore provide her with care for her and her baby after she has the baby. I mean, this is the insanity, right, of this system. If we've learned nothing else from the horrors of the COVID-19 pandemic, I think that we have learned that health is indeed a public good and not a consumable good. And the insulting question of who deserves health care has been definitively answered. We all do, because we're human, and that's it. It's just that simple. The way we deliver healthcare in America is broken, right? And it's getting worse. And it's, we sort of summarize the problem to say it's too expensive, there's uneven quality, there's un and underinsured people, there's a declining number of workers that are even covered by their employer, and there's a lot of administrative waste. The thing is that when we've been trying these solutions recently, what they amounted to is making it more difficult for us to actually get the care. That's not the right kind of solutions, right? I mean, limited networks, co-pays, deductibles, restricting coverage, prior authorization, those are all business strategies. They're not healthcare strategies. We really are in a fight for the heart and soul of our country, for our common humanity. But because of this current political environment that we have in our country, it's not as simple as we'd like for it to be, right? To just make this change. And quite frankly, it's really highly unlikely that we're going to be able to make the big change necessary that centers our common humanity as a single sort of bite wherein we swallow this elephant whole in making this big change in our healthcare system. So the labor campaign, as well as Healthcare for All Minnesota, have really reached the conclusion that we're going to need to eat that elephant one bite at a time. It is possible to get to Medicare for all, single payer, via a pathway. Now, that's not a pathway that further entrenches this medical industrial complex and their proven failed ideas such as HMOs and ACOs and all that value-based payment junk, but looking at this as transition steps that literally live within pretty much every single payer bill, be it national or state-based, and start implementing those transition steps now. The movement has been so solely focused on passing Medicare for all, that the truth is we haven't really created the conditions that are necessary to actually win it. It's time to change up that strategy, I think. So the labor campaign is definitely thinking about what that strategy might look like, because from a labor perspective, we know that the employer-based healthcare system is a convoluted mess. And why? The question really has to be asked, I mean, why do we let our employers control our access to healthcare? Our employer-based system has resulted in a huge transfer of our wealth as workers to the corporations out there, and it has provided our bosses to be able to use our access to healthcare as an economic weapon in the class war that we're all engaged in. It's an absurd way to set up a healthcare system, disincentivizing entrepreneurship, career movement, and advancement based on our fear of losing our access to healthcare. You know, organized labor certainly deserves kudos and a pat on the back for the really incredible work over the decades that we've done to secure better health benefits for workers covered by a union contract. But we have to be honest about the fact that we're all still on some level held hostage by this industry that has the audacity to think that they know more about our treatment needs than our provider does. Plans don't cover everything like dental, hearing, and vision. Usually you have to have separate, products for that, need separate plans. You need, there are less and less employers that are offering dependent coverage that they contribute towards. They're just paying for their employees only. Everything else comes out of pocket. All of the out-of-pocket costs are generally there for workers as well, maybe a little less, but there still generally are the co-pays and the deductibles and potentially even the co-insurance. Our choice is still limited when it comes to providers and hospitals. And of course, we have to negotiate this beast. And it has become such a struggle between this so-called benefit of health insurance and our wages. And that has just caused gross wage stagnation, not good for our economy overall. And the end result of our access being held in the hands of the bosses, they use healthcare as a weapon to divide us and conquer us, whether that's retirees versus active, senior employees versus less senior. They're constantly pitting us against each other. Solidarity begins to wane, and we all lose when that happens. Based on that bargaining dynamic, the labor campaign for single payer is really thinking through kind of what are the next big things that we need to be doing, such as confronting the status quo and how do we get everybody to understand it's time to change it up. The privatization of Medicare and all of our public health programs, whether they're state-run or federally run, expanding and deepening union support through the labor campaign. We have a very, very intense focus on bringing more unions into the healthcare justice movement, recruiting young workers to be at the forefront of this movement because they are so greatly impacted, obviously, by the system as it's set up now. Engaging in real meaningful debate with all unions so that everyone feels heard, everyone has a voice at the table. Of course, the Democratic Party, whether we're in labor or outside of labor, is in and of itself a bit of one of those things that we have to sort of take on and figure out. And then the evolving from this pandemic, particularly around the organizing we do. This tool we're using tonight, right? Zoom, it's great. I'm glad we have it, but you know how valuable one-on-one conversations are, and many times in person is so much better if it's possible. So we're struggling with all of that and kind of pulling that all together by creating a new structure inside of the labor campaign and engaging more and more leaders and rank and file members to help us do some of this work. And it's pretty exciting. Speaking of organizing, the American labor movement is, of course, experiencing kind of an organizing moment, and that provides us some real opportunities inside of the labor campaign around Medicare for all. There are the strikes, many of which it still involve health insurance, right? Then health benefits. We just had the reintroduction of the bill. Our youth, as I said earlier, I swear they're going to save the world. What's happening to our retirees with, being forced onto Medicare Advantage, lessons that we've learned from the pandemic, the current atmosphere of just worker upheaval, right? The workers are understanding that they're connected to each other and they are better off with a collective voice. I think there are some opportunities to push the Bush administration. He says he's not going to do anything with Medicare for all, but he's indicated some willingness to potentially drop the age from 65 to 60. When the Build Back Better was getting debated, talking about expanding the coverage to include some things like hearing, dental, and vision, the drug negotiations. So I think those are all stepping stones. Those are good things to have happen, and they will actually create opportunities for people to have better access, and for us to start to poke the industry in the eye and get a handle on some of these major cost drivers. And then, of course, we have our rural healthcare crisis. The hospital closures and reductions of care in our rural communities across this country is absolutely inhumane with what's going on. So for labor, it really comes down to this. In the other industrialized nations in the world, as all of you know, that provide healthcare for all their citizens in some way, the unions in those countries have figured out that they can't keep their own healthcare benefits without everyone having access to healthcare. We have made some great progress injecting this issue back into the mainstream, with a majority of Americans now supporting a Medicare for all type system. But our primary mission still remains unfulfilled. With very few exceptions, labor has not moved beyond resolutionary politics and into revolutionary politics. They have not taken this issue up as an existential fight, politically prioritizing it and resourcing it, and that has to change. This is important because when labor finally does so, we will win true health justice for all, and the labor movement has always been at the forefront of social justice change for all workers, and this is no different. Labor is uniquely positioned to help lead the way for Medicare for all, and it is our moral imperative to do so. It is really the ultimate act of worker solidarity. So now I want to move from sort of the national level to the state level and talk with you a little bit about some of that transitional work that we've been doing directly in Minnesota, because this is one payer states, around our single payer bill, the Minnesota Health Plan, as well as a little bit about how our state coalition's working these days. And how we're directly working with what has become the Minnesota Health Plan Legislative Caucus. And I want you to know a little bit about who they are and how that all is working out. So let me start by explaining what I mean by this is sort of our inside the Capitol game that we got going on. So similar to Medicare for All, their congressional caucus on a national level, Minnesota state legislators have formed the Minnesota Health Plan Caucus. The purpose of the caucus is to unite legislators around the Minnesota Health Plan, but it's also to meet candidates in election years, to explain the bill to them, to get them to commit to it, and most importantly, to get them to campaign on it. And being part of that caucus also entails that if you're a member, you are being out front about the legislation, you aren't hiding behind it, and you're not just giving lip service to it so as to kind of, keep the activists calm down. The caucus also works to educate each other on deep health policy issues. I was very honored that they brought me in, and I worked behind the scenes with Kip Sullivan to put this presentation together. And it was specifically on how managed care ideology has hogged the healthcare reform debate, how all of our elected officials, regardless of party, contributed to that mess, and why the value-based payment schemes, HMOs and PPOs and ACOs, and as I say, EIEIOs, aren't saving money, they aren't improving quality, they aren't decreasing disparities, and we simply have to stop this nonsense that just further entrenches these predatory, non-provider providers within our healthcare system, and we have to get serious about fixing this system. And that is with the only proven system that we know will work, and that's a single payer system. This was a pretty eye-opening training that we did for these legislators. And I'm convinced that that training helped us get some of the work done that we did in this legislative session. The caucus also works closely with us on the outside of the Capitol. So we are bringing those caucus leaders and having them attend many of our Health Justice Allies Coalition meetings. And we are working to hopefully begin scheduling with them interactive community health equity forums here coming up before session starts again next January. They are now out of session here in Minnesota. Before I dive into the specific legislation that we passed this session and that has been signed into law, I want to share some really good criteria that we've been using. I kind of cut this down and encapsulated it between Healthcare for All Minnesota and the labor campaign, because it really fits into these 5 basic buckets. So when we're looking at healthcare reform legislation, and Lord knows there's plenty of it that they try to throw at you, to figure out whether we see it as something that is distracting in an incremental way, or is it a transitional stepping stone that gets us closer to single payer? We run it through this, these basic questions. Does it strengthen the social insurance model? Does it help to decommodify healthcare? Does it move us closer to Medicare for all? Does it help us build power and bring in new allies? And does it help to weaken and divide the medical industrial complex and their allies? So once we get it through all of that, then we have a really better handle on whether it is the right kind of incremental step that is going to actually move us towards our single payer plan, whether on a state or a national basis. So last December, we at HCAM, and we partner up with PNHP here in Minnesota as well, we decided to mix it up a little bit. So we sent a letter to the Minnesota Senate and House leadership, as well as the chairs of the Senate and House health committees and the Minnesota Health Plan Caucus leadership. And we outlined for them our proposals for legislative priorities in relation to healthcare reform legislation. We felt it was important to let the legislature know where the movement was at and not wait for them to tell us where they're at when it comes to moving legislation, particularly that we wanted to make sure begins unraveling this convoluted, costly, privatized system and move us closer to the Minnesota Health Plan. So presenting these priority proposals proved to be actually a pretty successful model. The House Health Policy and Financing Chair, she reached out to us to review these priorities and to brainstorm one-on-one with us ways to actually begin to capture some of it and get it moving in bills in the legislature. So thanks to her leadership and that of other Minnesota Health Plan leaders, a significant number of our priorities were indeed included in the final omnibus health bill for the 2023 session. And I'm going to take these one at a time to demonstrate to you what we accomplished and what we're still going to be working on. Just so you know, Minnesota works on a biennial legislative year. So they had the session in 23 that went from the 1st of January to right around the end of May. And then now they will pick back up again in January of 24, and they will finish their work about the first part of May in 2024. This was a budget year. Next year, they can do a lot more with policy years, but we even got some money stashed aside to do some of the work that we need to do in starting to establish our single payer healthcare system here in Minnesota. So it's pretty exciting. This was a huge, huge win for Minnesota. I don't know about, I know everybody's at different places across the country on this, right? But we have never had an actual financial cost study done that compares the Minnesota health plan to the current healthcare system. And the bill was written with incredible specificity of what it will take in a state, single payer plan, whether it's reimbursements and how to get the money and what will be captured from the feds and many, many other things that are even over my head because I'm not an economist or a technician to that degree. But the bill is really specific about this, and it passed. And we got darn near $3 million to get this study done within the next 24 months. So we're pretty excited, or 24 and a half months or so. We're pretty excited about that. Now, we didn't get informational hearings. We were hoping to do those just really as an organizing tool, kind of like Representative Jayapal has done in Congress with the Medicare for All Act. But we're thinking about doing some of those informational hearings between now and the beginning of the 2024 session, and actually using it as an opportunity to educate on these stepping stone pieces of legislation that passed and show then how they tie into the Minnesota Health Plan, where we all eventually want to get to. So I think there's more to come on that one. So primary care case management is really nothing more than deprivatizing our public health programs and then doing direct contracting between the state and the providers, right? Primary care case management comes out of, I think it's Connecticut that has that type of a system. So we didn't get the system itself implemented, but here's what we did get. And this is, again, a good, really important step forward. The bones of that bill were captured in the Health Omnibus Bill by directing our Department of Human Services to present a plan by January 15th of 2026 to the legislature that reflects how much the state would save if we deprivatize our public health programs, Medicaid and Minnesota Care. I'll explain what Minnesota Care is in a minute, and what the legislature would need to do to move those privatizers out of the plan so that we actually have true public health programs in the state of Minnesota. Minnesota Care is a basic health plan under the Affordable Care Act. So you have Medicaid cuts off at 138% of federal poverty level. And then folks generally, if they don't have employer provided health care, then they go ahead and jump onto the exchange. Well, we have something that catches them in between 138% of federal poverty level and 200% of federal poverty level. It's a plan that was created in Minnesota back in the 90s because we saw people struggling, and it's a wonderful plan, y'all. It is a high actuarial plan, very small out of pocket. It's based on income as far as what the people pay for a premium. It's heavily subsidized for the state. So a family of four making maybe $35,000, $40,000 a year might pay $25 a month for the premium. And it's a 94% actuarial, platinum plus plan. And so under the Affordable Care Act, we were able to keep that health plan. So there is some, so we want to make sure though that it's deprivatized, because of course the stupid managed care organizations are heavily involved in that, as they are in our state Medicaid, excuse me. So this is really a significant step forward in building the Minnesota Health Plan infrastructure that we're going to need to implement that plan and keep it truly public once we actually do get a chance to implement it. So this is pretty exciting work that they're doing. We say everybody in, nobody out, and we got to mean it, right? I know the folks out in California did this a while ago, and some of the other states have managed, but we were able this time to include all of our undocumented friends, family, and neighbors in Minnesota will now be eligible based on their income, like everybody else, to participate in the Minnesota Care Health Program. This is huge. So many of those families are going to qualify now for affordable, accessible healthcare, because many, many more providers do actually participate in that Minnesota Care program. So this was really sort of a renewed commitment to our common humanity in Minnesota, and a huge win for us. Although we didn't get strict general insurance regulation, health insurance regulation, there was a focus on really trying to look at the Medicaid program. And in doing so, we passed no cost sharing at all for Medicaid patients in Minnesota. Children that are age 0 to 6 get to stay on Medicaid, even if their parents' income goes up during their time between age 0 and 6. you know, they just, oops, they get a raise and suddenly, right, they're off of Medicaid. The children get to stay on so that there's some consistency up to the age of 6 with their care provider, and they know that it is an affordable access to that care. And children and young families, adults 6 to 21, no longer have to file all of this eligibility paperwork every quarter, which becomes really cumbersome and difficult for many families because, you know, they're just striving to survive and they can easily forget, and then boom, they lose their access. Now it's only annually. So this will really make things so much easier for families to be able to have some consistency in their access to healthcare. Pharmaceuticals. So we were hoping to get a prescription drug affordability board, and we did. The board can set some upper pain limits for drugs, which would be enforced by our Attorney General, who is Keith Ellison. Whoop, whoop, whoop. We're very lucky. And this is something that we were excited about, although I got to be honest, it's a little weaker than we wanted. So we really probably need to stay engaged and keep trying to see if we can't amp this up and give them much more authority to deal with price gouging, particularly around pharmaceutical drugs. We have a really good piece of legislation that was passed in 2019. Regulating those crazy pharmacy benefit managers, that other cottage industry. And we were hoping to kind of add to that and amp that one up as well. We just didn't get to it this session. But again, we could be looking at that in 2024. I was asked to say a little bit about the nurses, having spent 9 years with them, my great honor to do so. And this is like, talk about a poster child for what we're all up against or going to be up against when it comes to trying to, move true healthcare justice. So the Minnesota Nurses Association brought forth a bill to create nurse management staffing committees in every hospital to ensure safe patient care. Unfortunately, Mayo Clinic executives issued an anti-democratic ultimatum, which Governor Walz accepted, that excluded Mayo and their patients and nurses from this better care and these better working conditions that the new law would have created. Mayo threatened to pull over $4 billion in funding to build a destination medical center in southeastern Minnesota if the legislature passed and the governor signed the bill with the staffing committees in it. So in the 11th hour of the session, the legislative authors of the bill announced an agreement on a compromise bill that includes several good nursing related provisions that were previously in that larger bill, including a study on nurse staffing and retention, new protections against workplace violence, and childcare assistance and student loan forgiveness for nurses, which is good. And they had passed and it's now law. But this was really so upsetting. I can't even begin to tell you that of all the workers that got shunned in this session, we have a trifecta, all Democratic controlled. For it to be the nurses after what they've been going through these last few years was really, really upsetting. President Mary Turner made it clear. She said, "Today, my heart breaks for patients in Minnesota. We came here to pass the Keeping Nurses at the Bedside Act because of the power and influence of the corporate healthcare executives. That bill has died." So the fact that our nurses don't get a voice in staffing decisions is just shameful. Nowhere during this session was the power of corporate healthcare more insidious. Shame on Mayo, the legislature, and the governor for failing our nurses and their patients. Certainly, as I say, demonstrates what we're up against. I just want to mention a couple other things. In partnership with coalition organizations, particularly those representing communities of color, we supported legislation that impacts health via the environment. The cumulative impacts legislation puts power into the hands of the community when it comes to permits for polluting facilities. That passed. There's a creation of a Center for Healthcare Affordability in the Health Subcabinet. The important thing there is they're both being directed to look at administrative waste and administrative spending. We all know where that's coming from, don't we? That's the privatizers. So they're finally, hopefully, going to be digging deep and looking where they should be looking for that. Minnesota is also looking at the possibility of a public option. They want to do it via expansion of that Minnesota Care program I told you about. HCAM hasn't taken a position in support or opposition because there's still a lot of unanswered questions about it, but we certainly want to be engaged as they're doing the work around this, because we want to make sure that if they're going to be talking about a public option, it's truly public and it doesn't have another bunch of MCO-laden products inside of it. And then a much needed increase in funding for nursing homes and securing paid family medical leave and earned safe and sick time for all workers in this state. All an important step when it comes to dealing with, of course, social determinants of health. So the final analysis, we did good. We built some infrastructure for the Minnesota Health Plan, and corporate greed exposed its ugly head to let us see just how awful they are. So now we have to create that full-blown campaign to slay them before they slay us. The 5 buckets, I'm not going to go through them. You can see them here. These were the opportunities we have for our continued involvement to influence how these 5 specific programs and studies get dealt with. We've sent letters to the commissioners of health and of human services, informing them that we fully intend to be engaged as they begin their work on studying and providing implementation plans for the public option, the deprivatization of our public programs, and the Minnesota Health Plan cost study, as well as the examination of that administrative waste within the system. We have to do this so the managed care sycophants don't heavily influence and override the good work that is being done here to get them the hell out of our healthcare system. So whether the work is national or whether it's a state-based, I think the strategy of beginning to think of how to implement the system we want, maybe pieces at a time, but in a way that creates the conditions we're going to need to make single payer possible, is our best chance at this point at winning healthcare for all. You can see there are a couple of ideas that I have up on the screen. I don't want to repeat them. I'm going to get you all these slides so you can read them later. And I don't want to take up more than my time than I'm supposed to. So I want to pull this all together by reading a blog that was written by a Minnesota nurse, Emily Pascala, during the peak of the COVID-19 pandemic, because I think it really explicitly lays out why we are in this movement together with one another and why we simply cannot give up on the fight for single payer healthcare. Emily wrote, "If I die, I don't want to be remembered as a hero. I want my death to make you angry too. I want you to politicize my death. I want you to use it as fuel to demand change in this industry, to demand protection, living wages, and safe working conditions for nurses and all workers. Use my death to mobilize others. Use my name at the bargaining table. Use my name to shame those who have profited or failed to act, leaving us to clean up this mess. Don't say heaven has gained an angel. Tell them negligence and greed has murdered a person for choosing a career dedicated to compassion and service." Thank you so much for having me tonight. One payer states, "Si se puede, justice warriors. We shall do this, I promise."
Wow, thank you, Rose.
You bet.
So lots of news.
Yeah.
So I'm going to take questions, and if you can raise your hand, that would be super, and I'll see them up at the top of the screen here. If you don't know how to raise your hand, if your technology doesn't allow you to, if you can go like this, and somebody else please bring to my attention that they're waving, because I can only see like 5 boxes at a time right now. So I'd like to call on Sam Metz, and David Loud will be on the deck.
Thank you very much, Rose. That was very helpful. First, I have a request. If I can get to St. Paul, will you and John Marty sign my copy of his book, please?
John will sign it in a heartbeat and I'd be honored. Done.
I have a question about how Oregon reflects the rest of the country in terms of union support. There's a wide spectrum of union advocacy for single payer in Oregon. The Oregon Nurses Association, absolutely the heartbeat of single payer, state and national. Less so, but in second place is the two locals of the SEIU, service employees. Sort of being a little cautious are AFSCME, the government employees. Then there's a large gap to Teamsters, who in Oregon who advocate for national but not state-based healthcare.
Hmm.
And then there are a host of trade unions, carpenters, electricians, who regard this as the death of Western civilization. I'm wondering how this broad reception of single payer that we see in Oregon reflects either Minnesota or the rest of the US.
Yeah, so well, you're right. I mean, the nurses on a national level are leading as well. And I think they are in every state where there's a bill. For the most part, there might be some southern states where they aren't necessarily either organized in the union or, able to gather together as a collective. But overwhelmingly, of course, nurses are front and center when it comes to this. SEIU did endorse the national bill, which is good. I know here in Minnesota, SEIU Healthcare Minnesota, as well as their state council and their local 26, which is service employees like custodial, workers, and then as well as the school employees are all represented in our coalition and are with us on working on the state as well as on the national. We also have actually some representatives from Minnesota sitting on the national steering committee at Labor Campaign from AFSCME, and they're also engaged in our health Justice Allies Coalition in Minnesota. So it is possible, especially with what's happening with so many public employees, right, in this country, and the budgets of public entities going down and being hampered. And that means they'll start cutting at health benefits, right? So they're starting to see some of the value of having this thing off the bargaining table. We think we see a potential for bringing the Teamsters along a little bit because they had, they're a new election. Sean O'Brien is their new, their new president, and he has taken on UPS right now in a very big way. We may have the biggest strike coming up here in a few weeks with 350,000 UPS workers, Teamsters out on picket lines. So everybody better find their local picket lines for that. And he's pretty, he's more progressive. And so we're thinking through getting through the UPS negotiations here and then doing an outreach and seeing if I can't sit down directly with Sean or some of those that surround him to find out like a little more about what are they thinking. And, the state versus the national is an issue because it's different for some of these national unions, and we have to figure that piece out on the state level. And I don't have a quick answer for that right now, because there are some obstacles for us on the state level that don't exist if we could do it nationally, right? And we do have to figure that out and think that through. I think the most important thing is make sure they're in the room right from the beginning at the state level to at least have the conversation with you. The building trades, the Taft-Hartley Trust, they've been kind of the hardest nut to crack, right? I think some of them are like weakening a little bit around coming our way based on what happened in the pandemic when so many of their workers, certain industries like hospitality industry, nobody was working. So no money was going into the fund, but it was a pandemic, so they had to pay out. So I think that they're seeing that maybe it is time to think broader than the Taft-Hartley Trust. But I tell you what, think about this, when I tell you about the conversations I've been having with leaders around the possibility of some of these transitional steps, that has really been working. The machinists, the IAM, they were like, we support Medicare for all, but it ain't going to happen anytime soon. So what are we doing? What's the point? Right? I'm like, well, let's make it happen, right? Let's do some transitional work. And when I talked to him about some of those ideas, he was like, oh my God, yeah, that's a great idea. We could totally do that. Think about the Taft-Hartley Trust that have to carry early retirees who retire before 65. They have to pay full costs. I'm 65 now, so I get to say this. I mean, we cost more when we're older because, that's the cycle of life, right? We use more healthcare. Those are more expensive plans. If we got that age from 65 to 60, those Taft-Hartley trusts would absolutely see a gain in their trust fund because if they just bought the supplemental plans, right, as wraparounds for traditional Medicare, that would save them about 2/3 of the cost that they're paying for a full-blown plan for someone. So that's not going to automatically sign them on to Medicare for all, but it gets them in the room. It gets them in our space where we can start to build relationship, and maybe eventually we can get there. So my thoughts for whatever that's worth.
Oh, thank you. Great work, yes. So, whoops, David Loud, I thought had his hand up.
Yes,
and-
I do.
Oh,
I
okay.
do. I do. Thank
Okay,
you.
go ahead.
Rose, thank you so much. And actually, Sam asked the question I was going to ask you. So you've covered it. But let me just throw in, and I think you know this because I sent you the resolution. In Washington State, next week is the State Labor Council Convention. And we have a good coalition of affiliates of the State Labor Council who have sponsored a resolution that we're calling Level the Playing Field, to do what you already proposed in your presentation, to basically that folks in traditional Medicare have the same benefits as those in the private plans, and to go after the private plans for the fraud and abuse and help pay for expanding Medicare in that fashion. And the one other thing I wanted to mention, last year at the Labor Council Convention, we unanimously passed a resolution that's carried forward the commitment to healthcare as a right and Medicare and single payer as a principle, but specifically called on the State Labor Council to start a dialogue in the labor movement about universal health plans, both at the state and the federal level, and get out into the open the questions, concerns, the doubts, the opposition that some folks in labor have to that. And I just learned today from the Government Affairs Director of the Labor Council, who's part of our coalition, that that dialogue is now getting ready to move forward and is going to be brought to a retreat of all the central labor councils in our state. Because we it's one thing to pass a resolution, it's another thing to get this into the discussion in the locals and the rank and file and really work it through. So anyway, you answered my question, and I just wanted to report that we're working hard on moving this forward in the labor movement in Washington State.
I know you are, David, and I tell you what, I am working with PASARA, and I am also working to get connected to April Sims up there, your AFL president, right? Because this resolution that they're doing in Washington, I actually presented it to the steering committee of the Labor Campaign for Single Payer, who's got folks from all over the country. And I said, I think we should think about using this as a model, and we should all take it to our state conventions throughout the entire country. And this resolution, if you all haven't seen it yet from One Payer States, we can maybe ask David if he can get it to Mike or Chuck or whoever so they can disperse it. Because I'm telling you, it's a great idea. We are not going to get Congress to just wipe out Medicare Advantage. As much as I want to do it, they're not going to do it. And because they got too many constituents, you all know this, who are on those plans because they're what? Cheaper, they got a little bit better benefits, blah, 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 right? So tackling it from this perspective, along with the support of Representative Jayapal, she's doing some great work on this inside Congress, and saying, okay, let's start here. Capture all the fraud and abuse that's going on in Medicare Advantage, take that money and use it to expand Medicare, to make it competitive, hate that within healthcare, but you all know what I mean, with those Medicare Advantage plans, so people will be attracted to take traditional Medicare, right? And maybe we can use some of it to increase reimbursement rates for our providers, because we do need to take a look at that too. Lots of creative things going on there. So I think, because you know what, guess what? I just found this out. I mean, I shouldn't have known better after all my years in the labor movement. You probably know this, but the National AFL-CIO sells, pushes Medicare Advantage plans to the retirees of the American labor movement, my head. So I'm thinking through a strategy, right, on what would it look like to try to, got to be careful about this, right? But to slowly help educate the national that you guys are privatizing our Medicare, knock it off, please, right? And I just want to say, we also in the restructuring, David, we are actually creating a education speakers bureau and an organizing working group, and we have already started to reach out and figure out ways that we can start doing educations, not just for leaders of the unions, but in rooms with rank and file members, because we really have to start, getting it down, right? Getting it into the grassroots, so they will then push their leaders to do more than just pass a resolution.
Yes, and just the last word, thank you for all that, it's great, is I'll share the resolution through one pair of states after we get it passed next week. It'd be better to have it, we pass this, not we propose this.
Thank you. It's a great model.
Great, thank you so much. So Lou is next, and then Jeannie's on the deck.
All right, I just unmuted myself and I'll lower my hand. And I love your comment, move from resolution to revolution. Thank you very much for that. But I do want to make a few comments on what Oregon is doing. Number one, I think Minnesota is kind of on the same mirror path as Oregon. In fact, in Oregon, we have talked to our legislators and they have passed a governance board that's waiting to be signed by the governor. I have no reason to believe that it won't be signed, but that governance board will come out and present, going through all the studies and all the things necessary, the whole universal health care package in 3 years. Now that's something, but I really believe Minnesota should talk to Oregon and Oregon should talk to Minnesota. So I want to remind everybody that one of the things that weaponized healthcare is the Janus decision many years ago. And so I watched AFSCME turn healthcare into a method of gaining membership by actualizing their membership, right? Even though AFSCME is in support in this state, very much so, of healthcare for everybody, right? So one thing we need to think about in talking to the Taft-Hartley multi-employer unions is, let's look at the cost. Because I talked to one of those and our cost, if we had state supply, even in the state, I know there's problems with it, right? But even within the state, our costs would be less than what their negotiating costs are with the employer. So it's very interesting. So lastly, the one thing I was curious about in your presentation with Minnesota, now realize we have a majority of legislators on our side, but you know how sides go, they can kind of go this way or that way at times, especially when push comes to shove. So I'm thinking, how did you get your legislators together to have trainings or to educate them? How did you do that?
Yeah, that was the miracle of this Minnesota Health Plan Caucus, because once they've got a couple of House members and a couple of senators that are sort of, in their leadership positions. And in connecting with them, I was like, you should utilize this caucus as an opportunity to really help legislators understand a little deeper about the policy of healthcare. Because, let's be honest, you get elected to anything and you're not going to probably know everything about everything, right? So it's like, can I get in front of them to talk? I don't have to sell them on single payer. They're already sold, right? They're in the Minnesota Health Plan Caucus. I need them to understand that when the powers that be at our state agencies come over and say to them, oh, we have this fabulous idea. We're going to do this new integrated health partnership, and it's going to be based off of incentives for quality care. And but that immediately, if nothing else, a great big flag goes up, that they turn around and if nothing else, they look at them people and say, really? Prove it. Because when
Right.
you say prove it, guess what? They can't. Because there aren't any studies that support their BS that, that all of these things have actually done this wonderful cost containment or
Right.
any of that kind of
Right.
stuff, right? And it's like, I need you all to understand this is business strategies. It ain't healthcare strategies. You
Right.
got to nip it in the bud right from the beginning. So
So
Thank you.
how did you, what was how did you get there was actually a healthcare caucus in your legislators?
yeah, so I have been suggesting to the author, John Marty, to the author of our bill, for a while, I'm like, John, why don't you think about doing what Pramila did out in Congress? Why don't we just have a state like single payer caucus? And he's like, oh, that's a good idea. But he's like, maybe I shouldn't be the one to do it because, he's the guru, right? The king of single payer. He's like, it'd be great to get some others. Well, a couple of years ago, we got a DSA person elected to the Senate from Duluth. We got another DSA person elected from actually a suburb in Ilhan Omar's congressional district. We got some nurses elected. And believe it or not, somebody who used to work for Blue Cross Blue Shield here in Minnesota,
Look at
who
that.
just hates insurance, knows where all the bones are buried. And she got elected. And those guys, those new people,
Yeah,
they
yeah.
were like, let's do this. Let's create this caucus. Now, I will tell you this. They didn't have the Senate back then. The House was Democrat,
Yeah.
Senate was Republican, okay? So they had more time to sort of like strategize with us and do more fun stuff. Once Minnesota went all Democrat
Yeah.
for 2023, the caucus has been a bit dormant during the session because honestly, other than that stuff that happened with the nurses, we kicked ass, you guys. I mean, we driver's licenses for all, restoration of voting rights. Every kid gets free breakfast and lunch
Right.
in all the schools in Minnesota. I mean, we passed a lot of progressive legislation, right? So they just didn't have the bandwidth to take on like this stuff. So I'm actually meeting with one of those chairs of that caucus next Monday, and we're going to talk about next steps and what to do in preparation for 2024.
Great. Thank you, Rose.
Sure, you bet.
Love you.
I think it's a model to think about for other states too.
Yeah, yeah. We've got
Thank you. That's great. So I'll have Jeannie and then Sammy's on the deck.
Okay.
Jeannie?
Is it true that unions sign 6-year commercial health insurance plans for their union members? And if so, could we agree that union members would not be taxed to pay for a new state plan until their contract obligation is completed, so they aren't paying for both? And would that help us to get more union support?
Yeah, I think, okay, so first of all, asking me whether they have signed 6-year agreements. I mean, I don't know of any unions off the top of my head that have 6-year agreement. I think potentially, and Cindy might be able to help me with this, but I think CNA at one time did like a 5-year contract with Kaiser maybe. But generally speaking, union contracts are 2 to 3 years. In some of these big ones, like the big, UAW, right, with the big 3 car makers, and they might be 4-year, or something. I don't know if they're 6. I personally have not heard that. But you bargain benefits, right? You bargain health insurance. So, but all of that still, it's not necessarily locked and loaded for all those 6 years or the expiration date of the contract. You've got some kind of benefit plan locked and loaded, but a lot of times that doesn't mean it's not going to go up year to year. You try to build something in that automatically, if it does go up, the employer is going to take some of that premium increase, right, and eat it so that the employee doesn't have more coming out of their paycheck. You hope to be able to interact with them about co-pays and deductibles and networks and all that kind of stuff. But a lot of times the employers are like, no, sorry, that's our gig, not yours. We don't actually have to necessarily bargain all of that with you. And so it's really kind of a real mixed bag. Here's what I've been thinking about from our state plan. And I said this to Senator Marty, the author of the bill in the Senate, and then the House author, Liz Ryer. I think we do need to put something in there. And I think I just heard from somebody that I know another state has already done this. I think we do have to say in there that the plan, first of all, that you should get to negotiate for whatever the portion is that the employee pays, that we could actually negotiate with the employer to pick up the whole enchilada. And I'll tell you why. In most cases, you'll see that that's still cheaper than what the employer is paying just for their portion right now. And that's what's going to hook a lot of, particularly in the education unions, because there are a number of teachers unions. There's a whole bunch that, particularly in the smaller school districts, that are really, really getting hammered with this, so-called benefit. But there's also in the big metros, where some of them have, they have what we would consider pretty darn good insurance, and some of them don't have a single penny out of pocket for a premium, and they see it as a loss if now they're going to have to pay 3% or 4%, right, of their payroll. So if they could negotiate that with the employer, then they feel better about it. It doesn't feel like it's a loss to them. I've also thought about, and I couldn't get the nurses quite to bite off on this yet, but we do have some model language through the labor campaign for single payer that can be proposed in contract negotiations from the union to the employer that basically says, whatever we're doing. But if either a state-based plan or Medicare for all comes into place, we all automatically go into this and we're out of your crappy right, private sector plan. So it's something for us to think about being proactive on, but I think you're right that we may have to do something under ERISA and all that on the state level that would at least in some cases allow them to get out of that before they would be paying any of the taxes towards the state plan. We got to think that stuff through on the state level. That's why it's a little harder, but I appreciate you raising that issue. I'm not sure if that helps much. I think we're still kind of struggling with it, I guess, is my answer, but it's a great question.
So a proactive idea is a good idea. Thank you.
Yeah.
Sammy?
Yeah, thank you so much for coming tonight. I'm one of the interns in the PNHP internship, and I've yet to leave Rhode Island, but I'm moving to Vermont to go to school in New Hampshire. So that's a fun little journey. But I'm curious. Here in Rhode Island, we have basically two organizations who've been like leading the fight on state-based single payer, and it's the DSA, the Rhode Island DSA, formerly Providence DSA, and the PNHP chapter of Rhode Island. So, they've done kind of similar to what you were describing of like, throwing everything at the wall, like going after PBMs, going for deprivatization, audits. I mean, whatever bill needs to be made, PNHP's got it, and it's pushed in the state house. But it had diminishing returns, so much so that the DSA is actually has committed now publicly to only running third-party candidates, independent candidates in the state, and it already has one state senator, and one state representative, both of whom are very willing to kind of go against the establishment, which is it's tripartite government, all Democrats in the state as well. So I'm curious, I see a lot of parallels with Minneapolis, and I wanted to hear if you had any insight on the benefits of sort of independent candidates who are not tied to these sort of internal establishment pressures and can really be a voice of clarity in these legislatures, if you've seen that or if you think it's beneficial. And then I also had a question around someone who's been mentioned a couple times, Pramila Jayapal. I'm just curious kind of when if you think the Medicare for All movement is going to sort of understand or look into these congressional people's tactical or strategical like deficits, because the way that she was operating at the beginning of the Biden administration alongside all these progressives, not utilizing certain leverage that they had. She was reported to have directly stopped Cori Bush from fighting for $15 minimum wage. I mean, there's a lot of reporting there. So I'm curious what you think about that and how these high profile names might not be pushing the line hard enough that we need them to.
Well, that's a lot. And that you're asking, I mean, We don't, I don't think we have any independents here in Minnesota at all that are elected, at least not certainly on the state level. I don't, and a lot of our local aren't party. They don't run by party anyways, so there may be some independence there. I'm not sure. You're not wrong, of course. I mean, we all know that the Democratic Party is co-opted, and it is, I mean, look, they sold out the nurses. It was all Democrats, you know, and they all ran saying, oh my God, of course, the nurses should have a say-so in staffing. And then as soon as big bad Mayo Clinic says, you know, we're going to pull $4 billion out of the state, you know, my feeling was like, don't let the door hit you. Bye, go down, put it in DeSantis's backyard if that's where you want to go. And guess what? You can give us back all of the nice tax dollars that we've been giving you and subsidies in all those years to do your job, and we'll build ourselves a nice community hospital again. I'd much rather have that anyways in a big corporate entity like Mayo is these days. But I got frustrated. And we've got to face this, even with this deprivatization stuff. We were hoping to push it further than we did. And some of that pushback was coming from Democrats. And we're like, oh my God, how do you not understand why this is a bad thing to have healthcare privatized, right? In our public health programs. I don't know what to say other than, I mean, it's just one of our jobs, and it's why one of the pieces of the pie I had in my presentation says we got to deal with the Democratic Party. And that's what I mean when I say that we have to create the conditions to make Medicare for all or single payer at a state level possible. Does anybody here really believe we're on the precipice of making it honest to God happen within the next year or two anywhere? I mean, if we are, great, let me know where that is, because I want to, you know, like learn from you and implement that model as quickly as we can, because of the very things that you were just talking about, Sammy, that exist. So I know, you know, one group, People's Action Labor Campaign, is working with them on a national level to think through a national strategy around toxifying the industry, but also really pushing inside the party at the moment, because we don't have a viable third party, you know, right now, to get them to prioritize Medicare for all and really take on pledging that they won't take money from the industry and that they will stand strong and not just, you know, back down when we end up with another potential Biden-Trump situation, right? And then that gives them the out to say, well, Biden does support it anyways, so we'll just, you know, play other games. So I wish I had an answer for you. I'm not really that politically smart, to be honest with you. That stuff makes my head explode. I get so frustrated with party politics. It was one of the hardest things I did in the labor movement. I hated doing politics, but you have to do politics or it'll do you, right? So there's no choice in it. I think we just have to try to infiltrate everywhere we can, educate where we can, run good, solid, true progressives that will take on these status quo Democrats. And, you know, I mean, Pramila, I don't know what to say. I mean, generally, I mean, she's, you know, she's pretty good on this issue. She's pretty awesome. And she is coming up with some strategies that start to push us in that direction. But I get that she also kind of, you know, well, wait, we better not push too much, you know, blah, 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 right? When all of this first came into play back in 2020 or whatever. So
can I ask what strategies? Because I worked on the Bernie campaign. I was a staffer, field organizer, and constituency organizer. I met her multiple times, asked her about these questions. She didn't really have any answers. And they don't go, I mean, these folks don't go on a lot of podcasts and YouTube shows, and
sure,
you know, they don't tell us. So, you know, if they don't tell us and the folks in the movement don't know, then, you know, what, I guess I'm curious to hear what the strategy is if we don't take advantage of those opportunities.
I mean, I think that the national strategies are the things that the Democrats are working around on Build Back Better, the negotiation of some, you know, pharmaceuticals inside of Medicare. Again, none of this goes far enough, don't get me wrong. Dropping the age, improving the benefits, capping the out-of-pocket costs in traditional Medicare. She's really lead on getting House members, and it's going really well from what I understand, signing a letter to push the Biden administration to use their power with executive orders to start to rein in Medicare Advantage. Again, not to do away with it, but to start to deal with the, the upcoding and all the stuff they do to rip us off, and how much they're costing us. And so those are the kinds of things that I'm talking about. I mean, I met with Bernie's staff. I was very honored to do that a couple weeks ago. And they're thinking through like primary care for all is, and I know PNHP has done a ton of work. I just downloaded it literally yesterday on primary care. And is that a place where we could start something? So I think they're trying to think through it. I mean, if you look at the Jayapal bill or a Sanders bill, they have a section on transitioning, because if we passed Medicare for all tomorrow, we wouldn't have Medicare for all cards the next day. In both cases, we have to transition out of this system and into the new one. And so it's like, let's look at that transition language and let's start implementing some of those things, now on the outside, so that as we create these other conditions, which is the party work we have to do, taking on the industry, all of that kind of stuff on the outside, and maybe then we can meet somewhere and start to be ready for the full implementation of Medicare for all. So I'm sorry I don't have a better answer, Sammy. It's just not my bailiwick to know political strategy, I'm afraid. But thank you for the question. It's very important and valid for us to think about it.
So I am not able to raise my hand because I'm a host and they don't let me, but I'm going to speak next and ask a question, and then Lynn is on the deck.
Okay.
So I appreciate always worrying about making this be too partisan of an issue. It should not be partisan. Everybody should agree that we should all be taking care of each other, and a lot of Republicans will agree with that too. But so this conversation was starting to get challenging. But one of the things that Wendell said at a recent talk with all of our interns was at the end, he's talking about healthcare, money, and politics. All the pressures of the health of the money on our elected officials, going against what we actually need for what we actually need. But at the end, he emphasized that we can't just work on healthcare. We also need to work on making democracy work, which is a Leading in Voters motto. And so just reminding people that this whole third party thing, we cannot have a third party president in this country. It's very tough to have a third party person run because of the risk of what happens when you end up with pluralities in each house, and it's a mess. But you can do ranked choice voting at lower levels. But I'm wondering, in Vermont, we've had everything set up for transforming our mental health care system because we had too much hospitalization, and we didn't have the funds to do more community settings. We had this big hospital sitting there, and this is the way we had always done it. This is what we were doing, and we didn't have the funds to do the transition. But all the plans were basically crafted and was ready to go. And then Irene hit, talking about flooding in Vermont right now, but Irene hit, and we had all the plans ready to go. We rolled them out, and we were able to implement it. It was like because we were ready. And I'm concerned. We talk about the inside strategy, the outside strategy. We do our grassroots organizing. We try to develop these, the policy and everything. But as far as like the really nuts and bolts of how is this going to work, we don't have that. I don't know, whether you pull it from this piece is being done by one state pretty well, this piece is done by another. How do you mesh it all together, whatever? But our interns just gave this talk today about Cyprus, which just transitioned, passed the law in 2017 and implemented starting in 2019, graduating kind of a thing, and then COVID hit in the middle. But maybe we could have them come back and talk to Ontario States on another time, and have some of our activists here give some feedback about like what can we learn from that for what we might do here or something. I don't know if you might be willing to come back for that conversation because you have some Yeah,
Of
for sure.
course. I mean, we certainly don't know it all. We're trying different things to see what might work. And those interns are so wicked smart. And we've got interns that we work with here too in Minnesota. And I just, thank goodness for them. I'll tell you that. And I didn't mean to get overly partisan, because you're right. And actually, believe it or not, Congresswoman Omar, she actually doesn't have just a blue district. She has very purple suburbs, and she started doing door-to-door canvassing, and she is not knocking on just Democrat doors. She's knocking on every door, and they are not talking about Ilhan. They are talking about healthcare and how does the healthcare system work for you? How doesn't it work for you? If you could create a system from scratch, how would you do that? I talked to one of the lead canvassers who said it went really well, and they didn't get a bunch of Republican doors slammed on them or anything like that. And I mean, there are some that just ideologically, it's like, government ain't going to do anything right. So thanks, but no thanks. But many of them were like, they understood what Medicare was. They were glad they're going to have some sort of a safety net at some point in their life if they didn't have it already. And it made some sense to them, because unfortunately, almost everybody has a horror story related to healthcare, if not for themselves, with a family or friends or whatever. And I mean, that's really where it comes to it. And I was only relating frustration because we do have supposedly, right, the Democrats are kind of supposed to be more on this with us, and we're still fighting that fight. So you're right, we can't take any of that for granted on party side, because we also had Republicans who were supporting those nurses on the staffing committees when the Democrats caved the deal, right? So I didn't mean to get really partisan, so forgive me that.
Well, we all have to struggle with that. And partially because of what's coming at us from the media and from outside, even if we understand that it's a nonpartisan issue, you're just hearing that all the time.
Right.
But you were saying you weren't sure if any place was on the verge or likely to get it anytime soon. But New York, the biggest, like the one piece that's in the way right now seems to be unions. So that's a really important reason to have you come and speak with us today, because if New York could actually get unions on board, all these people who have co-sponsored a bill but haven't promised to actually vote for what they already have co-sponsored, if they actually could get those commitments that you're talking about with your training and your costs and all, then they could actually move that. So thank you so much.
Sure.
Lynn?
Hi, Rose. Wonderful presentation. I wish we had somebody like you in California. I just got off a Zoom meeting about our single payer bill, CalCare. I even thought of maybe a Hollywood celebrity getting out there and, had the star power to spread the word. Anywho, I was going to comment. I do a lot of phone banking for progressive candidates, Democrats, all over the country, and have been actually quite successful. And there's a lot of great new candidates come. But one thing that's always discouraged me is I try to look up the candidate before I do the phone banking, and I go to issues. And I am so discouraged time after time that everybody talks about housing, minimum wage. None of them have healthcare as an issue.
Wow.
And it's shocking. And so I kind of like to know ahead of time, does this person support Medicare for all?
Sure.
And sometimes they're Bernie, our revolution candidates, and progressive Democrats of America. So I know that must mean they are for single payer and stuff. But have you noticed a trend? I mean, how do we get these Democrats to have healthcare as an important issue when they're running?
Well, I think, a couple of things. I mean, obviously back in 2016, when Bernie was running, that's where we had kind of a peak of it was the buzz, right? I mean, because he made it the buzz, and it was absolutely wonderful that he did that. And now it's kind of like slipped off, right? Especially because, again, you've got Joe Biden on a national level anyways, and Biden is clear he doesn't support Medicare for all. So I really think that, I mean, part of it, at least on the state level, is I love that this Minnesota Health Plan Caucus, they are helping to recruit candidates themselves, and they are very specifically saying, healthcare is a problem, right? And with, I don't know about you all, but our, ACA exchange called Minsure just announced we have to have a minimum 8% increase in our premiums, or my God, we're just going to explode or implode or whatever. And I think probably if you talk to most trade unionists that are at the bargaining table right now, they're getting slammed with teetering on, if not getting to double-digit increases again on these insurance premiums. Well, at the same time, you saw those headlines that I had at the very beginning of my presentation that, they're profiting like crazy. They're selling or buying back their own stock to, increase their profits. That stuff is starting to get some traction again. And so I think there is hope for 2024 for this to get something of a spotlight again. But again, on a national level, it ain't going to be Medicare for all, because if it's Biden who's going to be the, nominee, he's not going to talk about that. But I do think we can get some traction with congressional candidates to raise the issue with them one-on-one, and then and for us in Minnesota, it's these state legislators who are willing to hey, this is still a problem issue. You need to know what the fix is. You need to know why this is the fix, how to talk about it, how to educate your constituents on it, and how you're going to govern on it. And that's really a major piece of the work of that caucus. And if we can pull that all together in a real way, that's going to be exciting, because a lot of the candidates, we didn't think we were going to get a Democratic Senate. We won it by 1 seat. And that hard work got us all of this really strong progressive legislation this year that really takes care of human beings instead of corporations. And that's because they were recruiting specifically very strong progressive candidates to run, and then they ended up winning. So I don't know again, I'm not sort of a big political, brainiac or anything like that, but that seems to be one thing that is, I think is a good thing that we're doing, at least here locally.
Great. Thank you. So I'm not seeing other hands right now. Am I missing?
I didn't see any either, and I didn't see any comments or questions in the chat either at the moment. So
I actually have a comment, but I just want to bring to people's attention to read through the chat. So some of my interns have mentioned some areas that they're particularly interested in, and some of them would like to have recommendations for speakers on some of those topics for their SNAP chapters, or for their potential SNAP chapters if they're able to get some started at their schools. I'm so excited that we have interns from Florida, Virginia, Mississippi, Louisiana, Texas, Arizona.
awesome.
So there are not strong PNHP chapters in all those places. So they are looking for speakers. So if you have recommendations, and if you know people in those states, that's phenomenal. And if you don't, then they could use speakers by Zoom as well.
Well, maybe Betty, you could follow up with me with an email with giving me, again, capturing those particular states, and I can absolutely look at least from a national level for a labor campaign perspective, but also, of course, working with lots of the different national organizations to see if they have speakers. I know I just did some work with our PNHP SNAP interns last week and kind of laid out some of this very work I laid out to you all, and had a great conversation with them. And I did a presentation to the UMass Boston a SNAP chapter there, or no, I'm sorry, it was Brown University just started a SNAP chapter, and they asked me to come and talk with them a little bit about some single payer 101 and the different ways to, talk about the issue and stuff. So I'm happy to also help with that, but it's just not about me. Got plenty of people that can pitch in and are wicked smart to be able to do some of these presentations. So why don't you email me what you're looking for, and I'll see if I can help fill in some of those places for you.
Great. Thank you so much. Thank you.
Absolutely. It's been my pleasure.
Do we have any other questions?
Doesn't look like it. And I'll make sure to send, should I send it to you, Betty? Should I send my presentation to you in case you want to send it out to folks, or if people want access to it?
You can give all your stuff, your slides to Mike. That would be
Mike?
super.
Okay.
He's the one in charge of collecting and sending that stuff around.
I will make sure I get that to him no later than tomorrow morning, if not tonight when we end here. Perfect.
Marvelous. Thank you. Yeah, great slide set. I'll have to, when I moderate, I don't take it in as well as I would if I weren't also looking at the chat now,
Sure.
so looking
Totally
forward to seeing this
understand.
slide again. And also the recording. Whoops, we have another question from Hank Berheis in Maine.
Oh,
All right. Yes,
hi.
thank you. Question about labor unions when you make the presentation. If you make the argument that, let's say they have 4 things to negotiate: pay, working conditions, retirement, and healthcare. If healthcare drops off the negotiating matrix, because it would then be the thing that we want. Do you find that helps? Has that resonated with them? Like, boy, we could be in a much better negotiating situation if we only had 3 parameters to work on instead of 4. What do you get from from labor when you sort of hear that, or does that work for them?
Yeah. I mean, generally, this thing is an albatross around our neck for most of us in labor, because we can't bargain it anymore. It's just failed strategy to think we can negotiate health benefits. I mean, we actually have a common enemy with our employer on this one, because most employers hate that insurance crap as much as we do, and having to figure it all out and hire somebody to, do the plans every year and the renewals and the blah, blah, blah. So what we say to them is it's time to take it off the table, recognize it, as a human need and therefore a human right. And how about we get back, you said one of the things we bargain over is retirement. Well, there isn't a whole lot of that kind of bargaining going on anymore. I mean, we don't have, there is not a whole lot of defined benefit pension plans going on out around anymore. It's defined contribution, 401k stuff. How about we start negotiating for a secure retirement again, right? And retiring with dignity. We could be negotiating over childcare, having some kind of reimbursement funds for childcare, for elder care. Our world has changed in some ways. So if we didn't have to deal with healthcare and we had that beast off of there, most of the unions that are certainly on board and really excited about it are like, yeah, we don't need this thing. There are many other things we could put our laser on and really make working life something much more pleasurable for workers. So it's mostly the Taft-Hartley Trust, right? I mean, it's the one that because right there, and I get it, they worked hard for those and they are very attached to them, and and it's a huge benefit for them with non-union subcontractors and all of what they deal with a different world. But at the end of the day, they still are having to deal with this insurance industry and PBMs and everything else. So I feel like if we can kind of peel that onion back little by little, and have those conversations with them about what would make a difference, maybe we can eventually get there.
I guess the loss of what the bird in the hand is not yet enough for them for the bird in the bush, huh?
Yeah, loss aversion is a real thing. And they also employ a lot of people and to run those Taft-Hartley trusts. So we also have to be really sensitive about the fact that we're trade unionists and we don't want people to lose their jobs. So making sure that it's very clear that everybody associated under the transition, right, the just transition, gets some help transitioning into new work or learning new skills or getting hired to, deal with the new system, whatever it is. We want to be really respectful about workers and how they're impacted. But yeah, and we're not necessarily going to get every union, just like we're not going to get every individual person or every company or, whatever on board with us. We don't need everyone. We just need a good chunk of us, right, to make it happen.
Yes, thank you. Any other questions? We've been holding Rose here for a long time, fielding a lot of questions. Thank you so much. So
Absolutely.
if folks have another question they come up with later, we can probably shuffle that toward her.
Yes, I'm on the listserv, everybody. So if you're on it, just go ahead and pose your question that way if you want to. Otherwise, I can put my email address in the chat just in case you want to just reach out to me personally. And I am more than happy to do this presentation or craft another one any way that it makes sense for you. If you'd like to have me as a speaker sometime, I'd be honored to do it for your individual organizations if you want.
Wow, thank you. And
Absolutely.
you realize you're putting this offer across the entire country.
I know. So I'm retired now, y'all. You know, and believe it or not, right? I'm doing all this
I
volunteer.
don't think she knows
Doesn't
what
feel very
retirement
retired.
means.
But I have an obvious passion for this work and, you know, the healthcare justice as well as worker justice. So it's a good fit for me to keep helping do this work. So glad to be in the fight with you all. Thank you for having me
So-
tonight. It's been an honor.
Thank you. And speaking of the just transition, Healthcare Now has given conferences that included workshops on that, and you can watch videos of that, and there are workbooks around that. Really important to be including in whether you're working on state legislation or in the national setting, and should probably
Yes.
be having stuff like that really laid out well. As far as that idea I was saying about having everything in place and ready to roll when the
Yes.
opportunity arises, you know. Mike has his hand
Absolutely.
up.
Yeah,
And thanks for raising that. I just want to say this really quick, Betty, because the labor campaign was actually integral in actually helping write the just transition language in the Medicare for All Acts that are in the House and the Senate. And the trainings are through the Debs Jones Douglas Institute in collaboration with Healthcare Now on a national level. And we are actually working to craft a variety of trainings inside of the House of Labor that are very specific to the unique sectors like public sector, Taft-Hartley Trust, you know, all of that, healthcare workers, so that we can really be sort of connecting very personally from that perspective specifically. So that's a big task that we're taking on. And when we have those ready to go, we'll make sure One Payer States knows that, in case it would be helpful to have you all connect up with some of our trainers. I'm sorry, someone else was
Great,
going to ask a
great.
question or say
Thank
something.
you.
Maybe Mike. Go ahead,
Yeah.
Mike.
yeah,
Mike,
yeah. I just want to thank you, Rose, for this wonderful presentation, and notify everybody to have these wonderful presentations continue. We would like you to donate to One Payer States along with your other fine charities that you give to. And there is a donate link in the chat right now. So please take advantage of that.
Absolutely.
And one other thing I should have mentioned when we still had 55 people instead of 24. Mike, my understanding is that the third Friday this month will not be happening. Well, we'll still have a third Friday. We won't have a meeting on the third Friday.
That's right.
Of this month, because Mike
That's
and Chuck and I all have enough other stuff going on that we weren't going to have leave for. So thank you much for coming tonight. And our next monthly noontime Eastern time meeting will be in August instead of the third Friday in July. And we'll continue with our second Tuesday educational programming. So thank
Wonderful.
you everybody for being here.
Yeah. Thank you.
And
And thanks to
thank
my
you,
Minnesota
Rose.
peeps who came. Love you guys.
Thank you, Rose.
All right. Good night, everyone.
Good night.
Thank you. It was great. It was great. Thank you.
Dr.
Okay.
Huntington,
Yeah.
if I might talk to you for a second. So hi, I do or if anyone else has questions or want to talk, I can wait till after. While I had you, I was gonna let you know I sent you an email today about the recording for one of our PNHP intern meetings.
Yeah.
And I know you had issues editing that.
I just completed it, and I'll put that in the chat too.
Okay, so you were able to edit it?
Yeah.
Okay.
What I had to do was video the video, and it's good enough quality that I think you'll be okay. So look it over, and if you have the raw material and you might edit it better, let me know. I can work with that.
Yes, sir. So
I'm confused about the raw material question, because I think that exactly what Sydney gave you, I thought was what Dixon worked on when he did the Wendell Potter one.
Somehow I wasn't able to convert it into an MP4.
were you able to download it? So if you went to the link, it would have went into Zoom and there'd be a little box at the top right corner that said download files.
Oh, I didn't try that.
That might be, oh, if you got it to work and it's good quality, then of course that should be fine. But if you wanted to, if you found that you would like it to be a better quality, or I haven't seen the video, but you could probably download it and see.
Okay. Let me send you what I have, and you and Betty
Okay.
can look at it inside. I put a Vermont PNHP logo in there and
Oh, good.
so that it's properly credited. But I'll put that in the chat.
Okay.
So, but it doesn't really matter to us what it looks like. It matters to you. We're not watching it. So I think what you'll probably want to do, Mike, is go ahead and download it and see if that quality looks better than the other one. We won't really be able to tell you whether the quality is good enough for your standards.
Well, I've invested enough time in it. I think I just would put it in your hands
gonna
and say,
call it
okay,
done.
this is,
We'll offer a second opinion.
yeah, offer a second opinion.
Okay. So but it's edited such that you've cut it down to be just the Warren, and you're going to be showing that at your meeting on the weekend, right? So
Yeah,
we don't actually need it for our purposes unless
okay.
we thought that, you know, as long as you've already cut it down to just Warren, and, you know, if it seems like it's a useful clip for us to label separately at the Snap chapter for some reason, I'm not sure, you know, if there'd be some reason to do that.
Okay, well, I'll send it to you anyway, and you can use it for whatever purposes. And I hope we can use part of it for our meeting on Saturday.
Okay. Okay.
So
Great.
I've sent you an email, and you should be able to find it in your recent.
Oh, okay.
And I also have your phone number too. So if you need, just let me know. Like, shoot me an email, and I can call you or something.
Oh yeah. And your email is in the chat.
I'll add it again. Here we go.
But do you want to put it just to Mike so it doesn't get printed? Because Mike sends the chat around to everybody. So if you don't want your email going to everybody, you should just send it to Mike.
Okay.
I can also introduce you. Should I just do that? Or did you already do it?
Sure. Yeah, I sent him an email earlier today that he might
that's
see,
right.
but
Yeah.
Okay,
yeah,
you
just
have
let
it.
me know.
Okay,
Okay.
super.
Let me know if I can do
You guys
anything.
keep track of it. If you're calling each other, just make sure you're not waking somebody up or when they've already gone to bed or when they haven't gotten up yet. Because you're on
Just
different
let me
time
know. I'm on Central Time. Just let me know if you need any help. But
Okay, I see
if
Sydney.
your video,
Sydney Ryan Kraft.
Sydney Bopatker, BHO.
Oh.
Patkar.
Oh, that's okay. Well, if you have it in the chat, I will find it.
Okay. All
Let's
right,
see.
just let me know.
I
Okay.
don't see it in the chat yet. Let's see. I'm gonna get down to the bottom.
Okay, guys, I'm just
Yeah,
gonna
I got it.
introduce you, and then
I got it.
You got it now? Okay.
Yeah. Okay.
This has
Thanks.
been recording this whole time, so we'll have a nice. You'll have to edit this out too.
Okay. All right.
Okay.
No, Mike will cut that off.
Okay.
Have a good
Thanks.
night, y'all.
Okay. All right.
Good night. See you tomorrow. Bye-bye.